Flying with a heart condition can be risky and require careful preparation if it is necessary. Here I am sharing steps I took that you should consider for your next long flight. I am in Singapore now, going back to San Francisco after 10 days visit from India. And after my open heart surgery, this was my first flight and definitely one of the longest one, which is up halfway across the globe. So I was anxious, worried, but everything turned out to be normal, no issues at all. So before surgery, flying was a nightmare for me. I used to feel a lot of nausea, always feeling like throwing up. Never had any food in the flight. It was really bad experience. But after the surgery, it seems like all gone. Everything is normal. And the reason I think is that earlier I had a lot of regurgitation. Body was getting only 37% of the blood. And in high altitude, when the oxygen level is even low, body was getting even less oxygen. But after the surgery, because that problem is gone, now I don't have that problem anymore. Atmospheric pressure can be very low at high altitudes, which means less oxygen is available to breathe because it reduces the amount of oxygen available in the blood. Increase existing heart condition like coronary artery disease or the heart failure potentially cause symptoms like chest pain, shortness of breath or arrhythmia. Now this video I am making for those who has a heart condition and planning to fly. Then you should take some precaution which is going to help you from any surprise. Individuals with heart issues should always consult their doctor before flying and may require supplemental oxygen during flights. Here are the things you should know. Atmospheric pressure can be very low at high altitudes, which means less oxygen is available to breathe, which can impact people with pre-existing heart condition who relies on optimal oxygen levels. Increase of symptoms. Reduced oxygen can trigger symptoms like chest tightness, angina, which is chest pain, and shortness of breath in individuals with coronary heart disease. Dehydration concerns. Lower humidity in the cabin can contribute to dehydration, which can further strain the cardiovascular system. Blood pressure fluctuations. Some heart patients may experience fluctuations in the blood pressure due to change in the cabin pressure. So when you are flying high altitude, the cabin pressure can go low, which will reduce the amount of oxygen in the air. So body is going to get less amount of oxygen, which can create significant risk for the people who has heart condition, and which will increase the chance of heart attack, blood clot, all those problems. So there are some precautions you should take. So I consulted my doctor before flying. Discuss your travel plans with your doctor to assess if flying is safe and to determine if you need any special accommodation like supplemental oxygen. I asked my cardiologist and here are the response I have received. Inside the flight, move around and stretch your legs every couple of hours to prevent blood clots. Wearing compression socks to improve blood circulation. It can help prevent blood clots during the long flight, particularly if you had a bypass surgery where one of your veins from your leg probably removed, and that will reduce the blood flow already. Medication as prescribed. Take your medication as prescribed and keep them in your carry-on luggage. Stay hydrated. Drink plenty of fluid before, during and after the flight to prevent dehydration. Avoid alcohol and caffeine as they can dehydrate even further. Taking a baby aspirin before the flight would reduce the chance of blood clots, even true for elderly with no heart condition. Get a seat with extra legroom are often found in the bulkhead rows and next to the emergency exit. Get a thorough medical evaluation before your flight to ensure your heart condition is suitable enough for air travel. Notify the airline about your heart condition so they can provide any necessary assistance. It is not just about the flight. Even after flight, you need to pay attention to your health. Make sure to drink plenty of water and make your body movement to reduce any chance of blood clots. Have a safe flight.